Today we are going to be talking about fascia. Welcome to your course, Training Fascia Applications in Program Design. I am joined by our presenter today, Lauren Shroyer. I'm going to welcome Lauren on.
Hi, Jackie. How are you?
Hi, good morning, Lauren. I'm good. How are you?
I'm doing great. Thank you. Thanks for having me.
Of course. Welcome. You obviously work for the American Council on Exercise. Lauren, everyone, is our Senior Director of Product Development at ACE and has been in the fitness industry for, we won't say how many years, right, Lauren, but a very long time, and has a wealth of knowledge to share with us. She's also an ATC, so has a lot of great information and great knowledge and experience in this area of fascia that we're going to be talking about today, right, Lauren?
Awesome. Yeah, I'm so excited to talk about the emerging science surrounding fascia. It's really a bit of a new discovery. So back in the day when I was going to school, the way we talked about fascia is very different than the way we understand it today. I'm really excited to bring this information to the group today and help to understand how to apply it to programming in a meaningful and a responsible way.
Great. Let's get right into it. I'm going to turn it over to you, and I will see you later for some live questions.
Awesome. Sounds great. See you later, Jackie. Awesome. So I am so excited to see so many people here today and to see so many people excited about fascia. We're going to talk a lot about research and theory, but I'm going to try to make it exciting and fun. I think people can find research a little bit boring, but what I really want to talk about is how to apply that great information to what you do every day with clients so that you can be more successful in the application of some of the modalities that we are already using, but understanding them a little bit differently and how they apply to fascia. So we'll talk about those emerging research findings. We're going to understand when mobility exercises or static stretching is most applicable to your client's needs. We're going to apply exercises and stretches that facilitate better mobility, stability, and elasticity, which is something we're going to talk about a lot today, and how to design a program that includes an emphasis on fascial training. So let's jump right into the research and theory. And one thing that I really want to point out here is that this is an emerging science. So as an emerging science, we need to be very cognizant of what we're hearing, what we're doing, and how we're applying those things. The results are still coming in. And in 5 years or 10 years, please don't say that Lauren Shroyer was a liar, none of that was true, because in 5 years or 10 years, I may be talking about fascia very differently. I hope I'm still invited to talk about fascia in 5 years or 10 years. I would be very honored to do so. The research that is coming out over these last 5 and 10 years, a lot of it is it's new because the technology we have to be able to investigate what's happening in the body is different. We're able to see things at a microscopic level that we couldn't before. Some of the theories of the past around fascia that we were unable to verify, we have been able to verify, and others we've said, oh gosh, that's actually not true. So I invite you to be, to be thoughtful when you are listening to what other people have to say, and understand that you need to take a responsible approach to digesting this information so that you're able to apply it to your clientele without doing any harm, but still broadening your definition of resistance training so that you're creating a resilient body in your clients. And that's really what we want to talk about today. So a few of the things that we're going to talk about are basic science research, which is like, hey, I saw this in a test tube or through a microscope. Some of the stuff we'll talk about today are case studies. So it's maybe 1 or 2 individuals who've actually gone through a study, and we've seen this phenomena happening. And we also do have some systematic reviews, not systemic, systematic reviews of research over a broad range of different types of research around the same thing, but not all of it's applied yet. So that application piece, it's still coming. And we'll talk a lot about how we can take this basic research and these case studies and still apply it in a responsible way to our training today. And I think that slide's going to advance. Here it goes. All right. So properties of fascia. We're going to talk a bit about fascia and really what it means, but fascia allows movement in 3 dimensions. It's fluid rich. Now, the picture that you're seeing on your screen right now is a cadaver. And so that cadaver is no longer fluid rich. So what we lose in some of the images or some of the ways that we've learned about fascia is the richness of the fluid. And what we see in that microscopic level almost looks like a 3-dimensional spider web that has dewdrops on it. So if you can imagine, and I hope I'm not freaking anyone out too much about the spider webs, but a spider web that's really 3-dimensional with dewdrops on it. The dewdrops are an acid, I always say this wrong, so I'm gonna try real hard. Hyaluronan acid that is a protein. It's a protein acid that is essential to that sliding mechanism of fascia. So when we talk about fascia, and as you've learned in your anatomy, fascia surrounds muscles individually and may serve as a structure of a foundational or a stabilization structure as well. But each individual muscle being surrounded by fascia means that that fascia needs to have a sliding capability so that when one muscle is sliding over another one and they are doing opposing actions, which is sometimes the case, then there's movement there and there's ability for that fluid movement. And so that's really what that hydration allows for. What's interesting is what we do to this structure all day long when most of us are sitting and stationary. So of course, exercise professionals do not tend to be sitting and stationary, but the average professional who you are seeing as a client is stationary for most of their day. Not only are they stationary for most of their day, they're sitting on a very important muscle group, the gluteus maximus, medius, and minimus, compressing those muscles into bone. And that compression is actually taking this tissue, both the fascia and the muscle tissue, compressing it and like a sponge, squeezing the liquid right out of it. So we're going to talk a lot about what that means and now how to apply that to your training and how to get an increased amount of slide between those muscles when you begin your warm-ups. One other thing that I want to point out too about fascia is a density of the proprioceptive nerve endings. And one piece of fascia that we're all very familiar with, the plantar fascia, the bottom of the foot, is a great example of this. If anyone has ever stepped on a Lego or on a or a stick outside while you're barefoot, and you feel the just sharpness, the intensity of the pressure at the bottom of the foot, you don't have to put a lot of weight on it to feel it. Now, if you do happen to put a lot of weight on it, it can be excruciating, but you don't have to put a lot of weight on it to feel it. That's because of the density of the nerve endings in the plantar fascia. This is an essential component of fascia. Those nerve endings are proprioceptive, they're pain, and they are especially mechanoreceptive. So they really are reactive to pressure that's being put on it. And because of that factor of fascia, we have to pay attention to training the fascia in that 3-dimensional component that it has, because if we don't pay attention to it, we're missing out of a lot of proprioceptive training that we can do. Now, another property of fascia is that its continuity is into the layers and into the fibrils, all the way down into the fibrils of the muscle cells. So that's something that we can see in a microscope. The reason there's a picture of an orange here is imagine that cross-section of an orange. And you can look at that and you can see that the even the pulp is sectioned off by these fibrous layers of tissue, right? Each section of the orange itself is almost like the muscle, and each tiny piece of pulp within is like the fibrils. So that is really what's happening within the body. That is how deep the fascial layer is going. But another thing to remember is that this is all connected. So there's no stop-start. It's not fascia and then over here fascia. Those pieces of fascia are connected to each other. So your fascia, whether it's your anterior deltoid and on the right side and your left gluteus maximus, through interweaving of fascia throughout the body, those two are connected. And we'll talk about how the integrity of the tissue throughout the body is really essential to ensuring that you have a healthy movement pattern three-dimensionally as a human. One other thing that I want to point out before we switch slides here is dispersion of forces. So when we think about dispersed force, and a great metaphor for this one is to think about a piece of material. So maybe a canvas on a tent, or even just a taut piece of cotton. If you pull on one side of cotton, the other side is going to move too. If you have that cotton and it's around a frame and it's pulled nice and taut, and you put a ball bearing on one side and you put a ball bearing on the other side, right? And you push down on the ball bearing on the opposite side, this side's gonna pop up, right? The forces that you are transmitting on one side of that piece of cotton are dispersed throughout and then transmitted on the other side. Fascia works the exact same way, and that connection goes throughout the body. Now, if it's a longer piece of cotton, and you're pushing down on one side, the ball bearing on the other side is not going to move quite as much. So yes, there is an orientation, but it is dependent upon how close they are and what is affected in between. So we'll talk about that when we get into the kinetic chain. But remember that dispersed forces happens within fascia, and it's a very important part of how we find strength and elasticity in our movements. As I said, highly sensitive to movement through proprioceptors, highly sensitive to pressure, and highly sensitive to the ability to stretch. And when you stretch the fascia, it feels that change, and it is sending signals based upon that change. And you can imagine why, right? You get to a certain amount of stretch with the fascia, and the fascia wants to say, hey, time out. Maybe we shouldn't be going this far. Let's pull it back in, right? So the fascia is part of that communication network and an essential part of that communication network of the body to the brain. One thing to note, though, is that through research, what we've noted is that heat will increase the ability to stretch. So quite a long time ago, a study was done on rat tails. So, you know, ew, kind of gross, but the study was done on rat tails. And the rat tail was heated. And as the rat tail was heated, what they found was the tissue of the rat tail actually became more extensible. Okay, and this is quite an old study, but it was one of those initial studies that started to think, what's happening here? What is that interplay of soft tissue and heat? And we are finding that the warming of the tissue is very important. Application-wise, we talk about warm-up being our first phase of program design. And creating heat throughout the body is important. Now, what we also have talked about more recently, probably in the last 5 to 10 years, is movement preparation. So not just getting on a treadmill and walking before you do an exercise program, but actually movement prepping, meaning that you're exercising or moving at a lower level of resistance, the exact tissue that you will train in your subsequent exercises. So that movement preparation is an important part of the inside your program progression to ensure that the fascia has the amount of elasticity that it needs to perform optimally. So some of the exercises you'll see later today are part of that movement prep, and we'll talk about how to make an exercise its own movement prep as well. So the functions of fascia: contractility and stability. So we want to think of a thick, strong rubber band, right? If we think of a muscle, we might think of more of a flimsy rubber band. It doesn't have a lot of stability all by itself. A muscle, if it's cut off of the bone, is just floppy, right? But it has a lot of contractility, and as you stretch and release, it will load, right? The stretched rubber band loads, and then you can release it and it'll go flying across the room. The muscle has that. It has this control, an ability to control the movement of the bones. The fascia adds to that an element of stability. There is some research that is pointing to the possibility that fascia has its own contractility. I'm excited to see where that's going to go next. We're not too sure, but there is some preliminary research that says that the fascia actually is contracting. So excited to see where that goes next. But it definitely does have a rebound, like a thick, strong rubber band, where as it's pulled, it will rebound. And we want to take advantage of that capability when we are exercising so that we can strengthen the fascia to become even more elastic and provide more of a stabilization. So we remember that any of our soft tissue or our bony tissue will react to the forces put upon it. So we really want to take advantage of the fact that we can put force upon that, force the fascia to stretch and then contract, or stretch and then release, and it becomes stronger. Tensegrity is one of the functions of fascia that is a little bit deeper to understand, but an essential function that fascia holds throughout the body. And one of the primary reasons that fascia is it's a kinetic chain concept. Tensegrity refers to that intricate network of connection that we talked about that's formed by fascia, where muscle to muscle, there is a connection. If we think about the pectoralis major and where it inserts at the sternum, and from right side to left side, it is not just muscle to bone to muscle, or muscle to tendon to bone to tendon to muscle. It is actually fascia overlay across that area where the right pectoralis major and the left pectoralis major are connected through that overlay. And that is the connection that is formed through every muscle where they connect into the bone. And then that next step of across the muscle, deep into the muscle, and as it connects into the next bone and into the next joint. So we're going to go a little bit deeper into this concept of tensegrity, what that means for movement and stability. Tensegrity refers really to this push-pull of forces to create form. So you have the stable and unbending structures of bones, and they're given a flexible or mobile support by these pliable, stretchable, but very taut and stable soft tissue. Fascia, muscle, ligament, they all work together to create movement that maintains the overall stable form of the body. So it isn't the bones that hold us upright against gravity, right? If you have a skeleton all by itself and you try to stack it upon itself, it doesn't stay upright, does it? It'll just fall into a pile of bones. So it isn't the stacking of the skeleton that's holding us together. What it really is the soft tissue connected to each other three-dimensionally through space that is holding us under that external load, which is gravity. So if we look at this bridge, I think this bridge is a great example. The integrity of the bridge does not come from the footholds that are walking across the bridge. It comes from the very flexible and very pliable strings or guide wires that are holding it together. And when those guide wires are loose, if they're not taut, the bridge becomes much more floppy. But that bridge needs to move in certain situations, a situation like this, or if you think about the Golden Gate Bridge or other places where these tensegrity style bridges are found, they need to move because of the wind, or they need to move because the earth is going to move. In San Francisco, the earth is going to move. So the bridge needs to be a bit flexible, otherwise it will collapse under load. And that is that theory of tensegrity. It gives you the form based on the tautness of flexible tissue instead of that brick by brick and mortar by mortar approach where it is not flexible or pliable. So our bodies are really held up with tensegrity through the soft tissue, not through the bony structure. Now, I think that for a lot of people, this is sort of a, whoa, I never thought about it ever. But at the same time, it makes perfect sense, right? They just never really thought about it. We have to remember that stability is less about stiffness and more about resiliency. And I just love this quote from an article by Roman et al. And at the end, I will share the resources so you can see where to get this. But resiliency offers the ability of the soft tissue to rebound and absorb forces while being stretched, and then transmitting the action potential through the network. So yes, this one's being stretched, but also as this piece of fascia is being stretched, so is the next one and the next one and the next one. So it is actually transmitting the potential throughout the network so that the entire network can work to decelerate that movement and stop it, or to grasp onto that action potential and rebound it, right? Like that rubber band. So the fascia plays a role in that stretch and rebound, but it also transmits those neurological messages to the muscle tissue to engage any necessary contractility that's needed. So that neuromuscular transmission of the message is now transmitting to the muscles saying, hey, we're about to stop this motion and rebound into the other direction because my eyes as proprioceptors say I need to catch this ball and then throw it. So muscles, we're going to need your help with that opposite direction, but we're going to be part of that because we have the action potential from the stored energy. I'm going to cut over here to a video. So if you'll hold on a second, I'm actually going to switch off my camera so that you can see this video a little bit more easily. All right, so I'm going to hit play on our video. And I want you to watch this hip drop. And feel free yourself to do this. Just stand up and do this with the video. I think it's always great to feel it. Oftentimes we're kinesthetic learners, so it's really great to feel what's going on at the same time. So this hip drop is really just taking advantage of the action potential that is in the iliotibial band, which is a huge, huge layer of fascia. So if we look at this again, you're just dropping that hip down, right? Dropping the opposite side hip down. And then in this position here, this is the right hip, right? The right hip, the IT band is in a big stretch, and you'll be able to feel the action potential here and the ability to rebound back. When you do this straight lateral hip drop, you won't feel a lot of your glutes working because you get a lot of action potential from the stiffness that is in the iliotibial band. You get a quick return or a bounce or a rebound. Now, if we added to that a rotational component and we start to bring that opposite leg behind, we might find that we need a little bit more of the, and I'm going to turn my camera back on and get us back over here to the slideshow, hopefully seamlessly, and back to camera as well. Once we add the rotation now, that perfect movement or that very straight movement of the IT band, it's not the same, right? We add a little bit of rotation and now the gluteus maximus, gluteus medius, the external rotators of the hip, they're all going to get a little bit more involved or need to be more involved to bring it back into the action. So it's just something to think about is that as we do this rebounding in this oscillatory manner, really what we're doing is improving the resiliency of this tissue. The tissue of the fascia is just stretch and rebound, stretch and rebound, stretch and rebound. So this hip drop isn't really an exercise, so to speak. We're not becoming stronger the way we would define that as in terms of muscular strength, but we are giving a stretch and a rebound to the tissue, asking it to be a little bit more active, and it can be used as a warming mechanism, especially in an individual who may have problems with their IT band and maybe they're having some knee pain. Well, this kind of a stretch and rebound and warming that tissue and getting it moving beforehand requires no knee bend. It's all happening at the other joint where up at the hip, where you can get that stretch and get a little warming and increased blood flow and increased fluid movement as well. So another point to this to remember is that our bones don't touch. And we're really glad they don't, because when they do touch, that's called osteoarthritis and it's horribly painful, right? Our bones are floating in space and they need these guide wires to create a stable form for us against gravity and against those ground reaction forces, so that when we land from a jump, we don't get a crushing blow between that tibia and femur like you're seeing on the screen here, but instead we get a catch where the soft tissue is part of that catch that's happening. So it is actually essential that we create this environment where the fascia can maintain distance between our bones so that there is mobility in that space. We create more space. It is the time that the bones are moving through a tightness or through an abnormal pull, that the bones move into these awkward positions and then touch each other. That creates the breaking down of the cartilage that is between the bones and potentially eventually could cause bone spurring or osteoarthritis. So maintaining the integrity of the fascia, the flexibility, the resiliency of the fascia is very important for overall bone health, because we're allowing the joints to have space, and space where they need it the most. All right, we're going to talk a little bit about tensegrity and apply it to the kinetic chain. This one I really do encourage you to get up and do this movement pattern that you're going to see on video here. Again, I'm going to turn off my camera and I'm going to share the video. All right, here we go. And with the kinetic chain, what this is really allowing us to do, so standing up here, you're going to stand up, put your feet underneath your hips, and then you're going to take one arm. In this video, I've got my right hand out. You want to look straight over your thumb. So the angle of the video is a little bit upward, so it's harder to tell, but really the thumb is directly in front of my eyes. All right, now you want to rotate backwards and see how far you can go. All right, you can bring your arm out to the side. Just make sure you do it the same every time. Okay, so now you see I've moved my feet closer together. All right, now do that same thing. Move your feet close together. Do your rotation here. Can you go the same distance? And you'll see one of the reasons I'm in front of this beautiful fence structure here is because you can see here that I don't go the same distance with both of them. When my feet are together here, my distance is not the same. And you are probably tracking the same things. You look over your eye, you notice it's less. So now I've done the same. I've crossed my feet over each other and done the rotation again. So you can see that with these changes in length, or what we would call tightness of that right IT band, we're actually not able to go as far in our rotation. So throughout the kinetic chain. Now what we're going to do is we're just going to pronate the right foot, right? So that's pushing the arch down into the floor. And what you're going to see me do a very exaggerated pronation here. So here's my full range of motion. You can see where I get on the fence here is almost to this slat, almost to that crack in the fence. And when I come back, now I'm going to pronate my foot. You see that big exaggerated pronation there, but you can even just pronate your foot a little bit. And now watch what happens. Look at the difference there is a whole slat of wood, right? So it's a huge difference in my ability to rotate from pronation of the foot. And you'll note that same thing in yourself. Even as I push myself here, I go into that pronated position. I push as hard as I can to get around. There's a huge difference in my ability to rotate. And I'm sure you're noticing the same thing in yourself right now. So it is really these small changes in our bodies that will create a kinetic chain reaction throughout the entire body that we need to be aware of. And that's why when we're working with our clients, we're not only looking at, hey, you have some stiffness in your low back and you're limited in rotation. Well, let's just work on your spine. What we just showed right here is, wow, you have this limitation when you're standing, but the limitation might not be the same when you're sitting. Oh, that's interesting. You're more bilateral while you're sitting. Let's look at your feet and your knees, and let's see what might be happening through the kinetic chain and how we might be able to affect it, and how that effect might be important by addressing the fascia. All right, let's see if we can advance this slide. Here we go. So tensegrity and overload is something that we're talking about here. So overloading a structure will cause it to break, but not necessarily where the load was placed. So you have this pain in the back, right? The spine is a very, very intricate place in the body. So you have a pain in the back, but maybe that is not the place where the overload is occurring. The break is going to happen at the weakest point, and that's what you need to be looking for as a professional. Where is that break occurring? Where is the weakest point? Why is it occurring there? So let's talk about static stretch versus mobility, and let's really get in here to that application piece. Like, what are we looking at? What is, how are we going to apply this? We need to improve mobility through a couple of different ways. And foam rolling is akin to manual sliding therapy. So some research has shown that manual therapies will support or improve the sliding mechanism of fascia when implemented in the direction of the slide. Okay, so again, it depends on what are you trying to create. You may want to move multi-directionally. The fascia is three-dimensional, so move in the direction you want to improve the sliding mechanism. For example, the IT band needs to slide in rotation as well as in flexion and extension at the hip. So consider adding a diagonal pattern and a perpendicular pattern, in addition to that straight up and down pattern that you're probably accustomed to applying to the IT band. I love to talk about, and we'll look at later, the latissimus dorsi, because the latissimus dorsi is a huge muscle in the back. It is a diagonal muscle, which means that it is very important during rotation, but it is also essential in the sagittal plane. And if you're working upper body and laterally as well, it is essential there. So how should you address the latissimus dorsi to ensure that you have the mobility you need through the upper body? The other part about the latissimus dorsi is the more an individual is stationary at a desk during long periods of time, it becomes tighter and tighter with the arms down to the side. It doesn't stretch, it doesn't move. When you're sitting at a keyboard all day long, it just becomes tightened and those muscles become less elastic. So we'll talk about that a little bit later. I'm getting ahead of myself, I'm getting excited. Another piece of information that I found really interesting is that a percussive mechanism increases the hyaluronic acid. So a percussive mechanism, meaning like a vibration technology that would actually percuss in that area, something called gosh, I want to say it's called the thumper, or it's a massage therapy device, and chiropractors will use it as well. And they did the research using that kind of a device, and what they found was hyaluronic acid increased after the use of that device, as well as with foam rolling or with that sliding mechanism. They saw that the hyaluronic acid could be moved around and in certain areas increased. So if we're thinking about the latissimus dorsi, if we're thinking about the gluteus maximus on which we are sitting all day long, perhaps we start out with a foam rolling of that area to increase the amount of hyaluronic acid in that area before we even go into a movement prep. Now this quote also from Roman et al., the same article in 2013, the inclusion of perpendicular vibration and tangential oscillation may increase the action of the treatment in the extracellular matrix, providing additional benefits in manual therapies that currently only use sliding motions. What does that mean to us? Okay, the manual therapy that we use that only uses sliding motion is the foam roller, and it is found to be effective. So we've already established that. We may increase, and again, this is early research, but we may increase with perpendicular vibration and tangential oscillation. How do we do that and stay within scope as a personal trainer or a group fitness instructor? We do not go and buy a thumper and apply it to our clients. That is not within the scope. That is the scope of practice for a massage therapist, for a chiropractor, because they are trained and licensed in all states of the United States. A chiropractor is licensed to practice this type of medicine, and a massage therapist is either certified or licensed to manipulate tissue. Personal trainers might have implements that are foam rollers that have a vibration technology, or a power plate that has a vibration technology that would allow vibration and oscillation to be a part of a stretch or of a foam rolling session. And by including that, you may find that a client has an increased range of motion or an increased capability and elasticity right off the bat. So it's something to consider if you have access to those kind of implements, to include that as a part of your warm-up or movement prep. Again, early research, so we can't determine cause and effect yet, and you'll want to be sparing in your use of these different implements to try them out and see how they feel. Communication is going to be essential when you try something new with any client, any exercise, any movement pattern. But certainly here with vibration technology, because some people find it a little, uncomfortable, and you'll want to make sure that you're well versed in the implement that you're using, whether it's a foam roller with vibration technology in it, or whether it's a power plate, that you're really well versed in the technology and exactly how it will affect the client that is using it. So creating stability and improving mobility. So all soft tissue is going to adapt to the stresses that are below the overload threshold, right? If you hit overload, you're no longer adapting, you just hurt yourself, okay? But the stress strain curve means that all soft tissue is going to adapt. There is a region here that is the elastic region. So mobility is working within that elastic region where the soft tissue stretches and returns. Stretches and returns. So this is not your range of motion, it's your range while you're in motion, right? Your full range of motion is usually tested passively or actively, but it's tested by your own movement not under weight. So elasticity, there is going to be some sort of a volume increase, whether it's speed, whether it's load, but the elasticity is dependent upon what that load is. So your range in motion may be different than your range of motion. How can you maintain elasticity? Once you go beyond that, you're going into the plastic range. We're going to talk about that next. So one other thing to note about this elastic range is that at this time, when you are moving elastically in the muscle tissue, you have your sarcomeres. And if you remember the importance of the sarcomeres, where you have the actin and myosin filaments that are creating that contractility, some research has shown that the sarcomeres will adapt over time. They will actually adapt and you will grow more sarcomeric connections during your training because there's a realization that there needs to be more capability in that elastic region. So this is just important to note that the elasticity and working elasticity is important. One more point about mobility. Mobility without stability is simply laxity. So I'll say that again. Mobility without stability is laxity. So to be mobile, you have to be stable as well. Otherwise, you just have this lax joint. And that's the opposite of what you need to be efficient in movement. Similarly, stability without the mobility is rigidity. So yes, you want it to be stable, but if it's too stable, now you're just rigid. So you need that balance of both the mobility and the stability so that you can have efficient movement. It's essential. So in application, what does this mean in application? Well, this means that we want to load and unload tissue in a rhythmic, comfortable range of motion. Remember, if we get beyond that comfortable range, we're going into overload and we're going to hurt ourselves. So it needs to be comfortable range. The load needs to be appropriate and it needs to be progressive. So as we talked about, those same movement patterns could be without load at all and progress as tissue warms up for an individual. For an individual who is aging and maybe collagen is breaking down and has less capacity for elasticity, we won't add the load, but we will still work through that elastic and rhythmic range of motion to ensure that we're maintaining what we have and doing our best to increase elasticity. So this isn't just true of the muscles, right? Elasticity, remember, is the fascia. Fascia is elastic, so this is really a place where we're working the fascia. Movement prep is also essential as it's activating the neurological system. Again, when you have older clients, taking time to activate that neurological system is essential. But even if you have clients who have been sitting for most of the day, we've got a lot of shutdown. It goes back to that hyaluronic acid and warming that area and increasing the fluid in the area to improve elasticity. So that movement prep, you want to do it in all planes of motion, not just a single plane and not just a generalized warm up for the body, but instead specifically joint by joint. Another thing is, movement has been shown to soften adhesion and scar tissue. So you might not break down all of that scar tissue that's there, because scar tissue is there for a reason. It's holding things together, but you will soften it and you will get a stretch and elasticity. So especially for somebody who is post-surgical, regardless of how long ago the surgery may have been, if you have a considerable scar, taking time to do movement prep in that area and warm that area is really essential. All right, we're gonna go ahead to our next video here. All right, one of my very favorite movement preps is the reverse wood chop. One of the reasons for this is that you can work the reverse wood chop in a progressive range of motion, load, and speed. It's really optimal for those muscles that have been sitting around for a long time and maybe haven't been working very much throughout the day. And now we've got the whole body working in this reverse wood chop. So this one is just one of my absolute favorites. You can do it. I have I think that's an 8-pound medicine ball in my hands. You can do it with 0 weight. And you can decrease the range of motion to what is comfortable. Working within the range of motion of the individual is essential. And you can see even myself here, those squats are not really deep, because my range of motion is not exceptional in my squat. I have some injuries that I'm working through right now, and that means I've got to be mindful of that. So one quick talk here about rigidity. So rigidity is plastic, which means that a long-term positioning will affect rigidity. We talked about this already, sitting at a desk for long periods of time. That's going to affect rigidity. And it's the #1 movement disruptor is our lifestyle. #1 movement disruptor, hands down. But the way we can affect that is through those long-term stretches. So we can apply a long-term stretch for optimal posture improvement. But I really like to apply inhibitory stretches to create a plastic change, so a permanent change to fascia and other soft tissue structures, so that we are redefining what that end range may be when we have a muscle balance issue. And one great way, and again, we're going to flip over quickly here to the video, but one great way to do this is to do an inhibitory stretch before an exercise. And if you guys want to stand up and do this, actually it's a great time for a movement break. Do a couple squats. As you can see, my sad little not very great range of motion squats here. And as you do a couple of squats, then you hold a nice long stretch of the hip flexors. Now I sped up the video here so you don't have to watch me hold each side for about a minute. You want it to be over 30 seconds. A minute to 3 minutes is actually ideal for the long-term adaptation of the body. But for an inhibitory stretch, 30 seconds is just fine. And now watch the squat here. Still not beautiful, but boy, it is deeper. And you'll notice the same thing in yourself. Assuming you've got some healthy hips, you probably will find that your squat feels fantastic after that inhibitory stretch. So really consider where an inhibitory stretch might be of value to your client as a part of the program design. And don't shy away from those inhibitory stretches as long as you know why you're doing them. And that's the really important thing about inhibitory stretch. Why are you doing that? Now, a lengthy stretch will also be disruptive to the neurological connectivity. So you don't want to do a lengthy stretch and then try to jump. You're going to need to reintroduce neurological activity before you go into the next part of your program design. But that lengthy stretch will inhibit these muscles that are tight. So let's talk about program design, which is always fun and exciting. We're talking about the considerations of fascia, elastic, and resilient. They suffer plastic changes from environmental stresses that we need to combat. They are functionally inhibited by tissue adhesion or scarring, and overload may cause injury or pain elsewhere in the body. Our 5 steps to success, which are introduced in depth in the Orthopedic Exercise Specialist program, but really these first 3 are important for what we're talking about today. We need to assess and observe. What do we need? What are we trying to do here? Identify the opportunity for the greatest impact on the individual or on the fascia itself, and then prioritize your program design. So as we look at that, elasticity and resiliency is essential. How is it impacted? Where is that opportunity for the greatest impact through the program design? and then prioritize it. The same for plastic changes. If what you're seeing is somebody whose posture has been terribly impacted by their work environment, then you need to prioritize that in your program design. And maybe that's even more important than the elasticity when things start. So considering what you're seeing in an individual is important before you decide what is the next step. So let's talk about prioritizing elasticity, and let's go into our next videos here, which is probably what you're all waiting for, which are the exercises that are just fantastic. So here we're going to start off with our Viper tilts. And the Viper tilt is a wonderful warm-up, and you can see through the arms all the way down to the heels, we're getting a posterior chain stretch as we go down, and now you can also see the rhythmic motion. I add a little rotation here. As I pull the Viper closer to me, you can see that my stretch is longer. I can go to 1 foot if I want to add a balance component here and add some difficulty. But this is a wonderful way to warm the tissue. Now, you don't need a Viper. You can actually use a barbell, a body bar, anything that you can kind of hold on to and lean out in front of you. Now we'll move into the lateral lunge and reach. Now this one's fantastic, again, for people who've been sitting throughout the day. Again, you can use a Viper, you can use a body bar, you can use a med ball. But what's happening here is as in this case, the Viper is moving through space, we're not only challenging, oops, went back a little too far there, we're not only challenging the tissue of the legs, but we're also challenging the fascial tissue across the back. And this is one of those ways that we can warm up the latissimus dorsi, because as we come across here, you can see how as I reach across with that left arm, the latissimus dorsi is stretching as I reach and then contracting as I pull back. So we're getting a beautiful rotation all the way across the body here from the right foot up through the posterior chain on the right leg and across the body to the opposite side. And we're getting a beautiful stretch, and it's a wonderful movement prep. This particular movement is being done right now with, I think that's a 6 kilo Viper, but you could do it again with even no weight at all and still be getting benefit for an individual. Okay, so the posterior reach is a higher level exercise for some individuals, and this doesn't have to go quite so far, but you can see now my anterior side, we're getting a beautiful anterior stretch through here as I go side to side. Now we have a crossover stretch to the opposite side, and now we add a little rotational component. I add that bounce in there for rhythm, and now I go rhythm side to side. Through that video right there, you're getting a progression, right? So it's easiest to go high, and now as we're going through here and adding that bounce and that rotation, now we're getting harder and harder. So note that with that, you can just reach that ball overhead, and just a chest to overhead reach can be an anterior movement prep for an individual before they progress into this movement, as well as just a very slow reach side to side. As I add speed to it, we increase the intensity. Here's a lunge variation. Again, this can be done and is often done with a med ball. So this lunge variation here, as you come forward. Now, what I love about the Vipers, now you can come sideways. You could certainly do this with a dumbbell in the right hand and in the left hand. And now we can rotate straight across. So that first lunge, as you noticed, was rotating down to the ground. So you get more posterior chain because of that reach, and you get a beautiful lat exercise. So this is not going to be used as a movement prep. Right now we're really getting into some strength, stability, and a lot of work happening, especially as you start to increase speed or you increase load with these exercises. And here we go into our most higher progression. As we have load and speed, we add some power in there, and And as I told you before, I've got a little hip injury, so it's not the most attractive one going on here. But it definitely does demonstrate how you can very quickly progress an exercise, be affecting the fascia, and get an increased benefit of elasticity and an increased benefit of contractility through very thoughtful exercises. As we were talking about too, and I'll just go really briefly here because this can get extremely complicated, but that crossover of musculature, as I talked about through the latissimus dorsi and down into the opposite side, happens right here through the thoracolumbar fascia that you see on your screen. Anteriorly, you can see where that crossover would happen through the pectoralis, down into the rectus abdominis and through to the opposite side oblique. So we need to think about how those crossovers work and what's really important as we're training our clients, and how have we warmed those crossovers? How have we integrated our movement patterns to ensure that the client is getting the most out of the fascial training? So it's much more about integrated movement from the toe to the hand than it is about isolated movement patterns. So many of the things you're doing already are probably, they fit the bill. Now you need to start to think about rhythmic movement, changes in speed to ensure that you're getting elasticity that's appropriate to your client level, right? A change in speed for somebody who's 75 is much different than a change of speed for a 23-year-old athlete. So make sure that you're being aware of speed changes and the level and capability of the client, as well as the tissue capability of that client, and where that tissue will lose resiliency as an individual ages. So static stretching, as we talked about before, it really is to improve homeostasis. So you're working that static stretching to ensure that you're getting balance through the antagonist and agonist muscle for postural correction, and then self-myofascial release to improve slide of tissue adhesion. You want to create an environment for adaptive change. So I'm going to show very quickly our very last video here, and I am being mindful of time. So if you'll hold with me for just a moment while we show this last video of multi-directional foam rolling. Turn off my camera so you can really focus on this video. And what you're looking at here is a sped up view of this foam rolling. And you can see now, as I'm working through the tissue, I'm working in multi directions. Rolling. I'm actually pinning the tissue under my body and between the foam roller and pulling and stretching the tissue. And now I'm going to roll laterally, which becomes a lot more awkward, but certainly just as effective to get some lateral movement, and then down into the rib cage. Now, finally, at the end here, you'll notice that I begin to move my body upward to pull the fascia of that tissue back. So this, of course, is going to start us right at the beginning. So here we go. We're going to rotate. We're going to pull it forward. We're going to pull it backwards. And that's how you're getting that multi-directional pull, and how you can be the most effective working with the foam roller and ensuring that you're getting multi-directional stretch of the soft tissue of the fascia while you're using the foam roller. Multi-directional stretch is what you're looking for on the foam roller. So remember, form counts. You want to work within the client's limits of their range of motion. You want to use heat and warming and movement prep to warm that tissue before the workout, and then address all the dimensions of movement so that you're impacting mobility and slide, as well as maximizing elasticity through appropriate speed. And then you get to assign regular homework for that improved adaptation and decreased adhesion. That foam rolling is a great thing for them to do on their own in between sessions, as long as you have their buy-in to get that done. So let's just pop over here very quickly to my resources. There is so much to learn about fascia, and one of my favorite resources is the Fascia Research Society. You can find their website online at fasciaresearchsociety.org. Fantastic online lectures there that are free, and more if you have a membership. So if you're super geeky like me and you want to have a membership to see all of these, it's really fantastic information. Another book that is a great one to have in your arsenal is Anatomy Trains by Thomas Myers. I have the second edition. I know there are new editions out that is actually expanding on his initial work. And finally, for your clients, but also a great article for you to read. It's called Muscle Pain. It may actually be your fascia, and you'll find that on the Johns Hopkins Medicine website, which is hopkinsmedicine.org. And again, it's called Muscle Pain. It may actually be your fascia. So I know we butt right over time here, and maybe we don't have all that much time for questions, but I will turn the mic back over to Jackie at this time to see if she wants to pull any questions here.
Hi, Lauren. Great job. Yes, we do have a lot of questions coming in from our live audience, and I'm going to ask you if it's okay. We'll take just one or two right now, and then we can send you over to Facebook to continue the chat like we do with our presenters.
I love it. Love it. Happy to do that.
Perfect. So you can type in your question here. If we don't quite get to your question, you can continue the conversation with Lauren over on the ACE Fitness Facebook page. That chat is up right now, and you can head over there to ask your question, and she'll be looking over those over the next couple days and getting back to you with those answers. But we do have a lot of questions coming in around the research that you talked about, Lauren. So on the percussive techniques,
yes.
We understand, and you talked a little bit about how it is outside of the scope of practice as an exercise professional to physically provide those percussive techniques to our clients, on our clients. So two questions around that is, you mentioned a couple of ways that we could sort of integrate that into what we can do that is within our scope of practice. And then is there any duration or length of time that we need to be aware of for those techniques to be effective, or
Excellent question.
Not cause additional injury?
Excellent question. Currently, the research is not application based. So that is one of those things that you really have to take into consideration, is since the research is not application based, we don't have that guideline. And being open with your client, asking the question, how does this feel? But also not experimenting on individuals that are outside yourself. So try it on yourself first, see how it feels, see what it feels like to you. You'll get at least a baseline that way. Then as you work with a client, you want to work with somebody who is kinesthetically aware, can communicate with you about how they're feeling, and is comfortable. And you'll have to ask them, are you comfortable trying out this new device? And accepting a no if they're not. If they're like, oh gosh, vibration plates, I don't know, I don't think so. That's fine, no problem. You need to make sure that you're communicating with your clientele and starting slow. So just like every exercise, everything that we do, we start slow, we start small, and we pay very close attention to the results. So, so that's really how I would recommend people use those. But they also do come with some best practices. The companies who are putting those out, the responsible ones, will come with best practices, and will come with videos, or will come with instructions that give you some guidance. It should not replace your communication with your clients, but it definitely is something that will help to give you a starting point.
Great, perfect. So as we normally would, we should be looking at the manufacturer's recommendations and guidelines and using those safely with our clients, just like any other piece of equipment, right?
Exactly, exactly.
All right, so one last question for you, and then we'll let you go and get to answering a couple other questions that people have regarding continuing education and other resources and other courses that ACE offers around this topic. We have that coming for you just very shortly, right after this, so stay tuned. And the last question for you, Lauren, is around we're maybe sitting a lot. We're on computers all the time, you and I right now, and probably everyone watching this right now. So what are the areas that we need to focus on, and probably our clients need to focus on when we're doing those techniques, when we're using our foam rollers, when we're trying to improve the functionality of our fascia? What are some areas that we need to focus on that we can do right now?
It's a great question. Excellent question. Really, there is no part of your body that is not impacted by stationary lifestyle. Not one part. There are parts of your body that show it more than others, and there are parts of your body that break down first. And those are the weaker parts. So you'll get it in the neck, in the shoulder, in the low back. Those are the areas that are most vulnerable to the problems. You'll get it in the knees. But the reason that it is different for everyone is because the weak spot is different for everyone. But the impact of being stationary throughout the day is catastrophic on all of our bodies. We are meant to move. So when we're doing some movement prep, it is essential that we are doing some slow progressive movement prep of the entire body in all planes of motion, ensuring all of the joints are moving and that you're moving in all of the directions, that you're taking time to address all of those things. That's why 10 minutes on the treadmill is okay, better than nothing, but 10 minutes being very mindful about a movement sequence that is going to ensure that your feet and ankles are moving, because they don't move throughout the day, and women who wear high heels are in a horrible position throughout the day, and then they go into flat running shoes and try to get a workout in, and they've lost that dorsiflexion. That there's abduction happening at the hip, so that you are able to move in those three planes of motions, that there's rotation occurring at the hip, because that does not happen when you're seated, that there's flexion and extension at the knee, that the spine goes through flexion, extension, and rotation, which again does not happen when you're seated. So really everything needs to happen. You need to go through your full range of motion of all of those joints. What's beautiful is if you can start working with clients on a consistent basis and give them that warm-up routine that they know and understand well, they can do it before you even see them. So instead of saying jump on the treadmill for 10 minutes and then we'll get started at 10 o'clock, now you can say, here's your warm-up routine. We've done it 5 times together. Now I want you to start doing it on your own for the 10 minutes before we start. And then your first check-in as a professional is, were you able to get it all in? And if you weren't, no problem, we'll do it together, because it's that important. So yeah, I think we're very accustomed to talking about the postural issues that occur, which is essential to address, but it is important to understand that none of your body goes unscathed when you are not moving throughout the day.
That's right. We were all made to move. So that's the goal, right? Is to keep moving.
That's right.
All right. So Lauren, I'm going to send you over to Facebook. Once again, if you did not get your questions answered here, Lauren Shroyer, our presenter and Senior Director of Product Development, will be over there answering your questions about fascia. And that'll continue over the next couple days. So, type your question in, give her some time to get back to you. We have a lot of questions here. So have fun answering those, Lauren. We'll continue with the rest of the slides. Thank you so much for joining us today.
Awesome. Thank you for having me, Jackie. It was fun.
So as you guys are closing up, as we're closing up our webinar here, remember you can connect with Lauren via ACE. So she is an employee at the American Council on Exercise, and you can connect with her via the information on your slide now. That's on our ACE Instagram or Twitter. If you have a question for her, just let us know. And once again, you can go over to that ACE Fitness Facebook page right now and continue that chat as well. So just a few other things to close up here and answer some questions for you. If you enjoyed today's presentation and you want to learn more about fascia and its properties and how to use different tools to improve your clients' fascia and other areas in their body, we have a couple of different courses for you. So one that Lauren mentioned is the Orthopedic Exercise Specialist, and that is available now. We also have other great shorter courses for you if you want to learn more about fascia. foam rolling, and recovery, and what fascia does in our body. So take a look at those over on the acefitness.org page. And remember, you are required to consume 20 hours, that's 2.0 CECs, for the renewal of your certification every 2 years. And ACE has provided you a way to do that for a low cost by joining our CEC club. So you can learn more information about that at the ACE website at acefitness.org as well. Next month, we do have another great live webinar coming up with our presenter, Anna Woods, who is the owner of She Strength, and she's going to be talking with us about adaptive fitness for special needs clients. We're really excited about this one and looking forward to having Anna with us to share her expertise in that area. So we'll look forward to seeing you next month. Remember, you can connect with ACE in a variety of ways. Make sure to let us know what you thought about today's live webinar, and let us know if you have any thoughts about what other webinars you'd like to see. Thanks again for joining us on today's live webinar continuing education series. Let's get people moving.